Today, we're going to take a deep dive into markings for body contouring, high definition liposuction. And of course, none other than Dr. Alfredo Hoyos, who is truly the master of three-dimensional liposculpture. Alfredo.
One of the keys here is that you see that the patient is standing up when we begin. Usually the trunk we do in standing up. They do contraction, but they don't need to bend. They don't need to do a lot of movements in the core muscles, specifically in the abdomen. But we do the two kinds of different markings. One is the deep fat versus the areas that we need to show the muscles. The big difference between different degrees of definition is essentially the presence or not of the high def in terms of the full six-pack, that is what we call the extreme, versus the moderate, that is only the vertical lines, but also insinuates the obliques. And in the basic, it's just the upper abdomen that we show in terms of lines. Usually in the lower abdomen, we just insinuate a little bit the shadows that are lateral to minimized line. When you saw that we mark the legs, for instance, we actually need to induce some contraction. And sometimes we need to even make the patient to do some contraction when they're doing like a squat. Because in that position, you actually accentuate some of the, especially the indentations behind the iliotibial tract, the muscles, specifically the division between the inner thigh and the outer thigh, that is the quadriceps. So when we have this patient in this kind of squat position, is the best that we can see.